Sleep and depression spin in a vicious circle. Low-quality sleep can lead to depression. Depression often leads to low-quality sleep. It's like the chicken or the egg. We can't really say which came first. We define depression as persistent episodes of disappointment, sadness, or hopelessness. Of course, there's a myriad of other symptoms you'll likely experience. All of these make it harder to perform daily activities. Leaving your bed feels unsafe. Going to work feels like a punishment. Feeding yourself feels like a chore. And of course, these are natural feelings to have at any given time in our life. We can feel symptoms of depression without actually being depressed. But if these feelings persist for more than 2 weeks, or if you feel them throughout most of the day, you may be dealing with a depressive disorder. If this sounds like you, then you might also notice how disrupted your sleep might be. You may have difficulty falling asleep at night. Once you do, it's often hard to stay asleep. As a result, in the morning, you feel tired and groggy, worsening your mood and restarting the cycle. Studies have found that most people with depression experience sleep problems and vice versa. In fact, many doctors will hesitate to diagnose depression if their patients don't report any trouble sleeping. So what are the most common sleep problems associated with depression? Insomnia, hypersomnia, and obstructive sleep apnea are the big three. In fact, 20% of people with depression have obstructive sleep apnea. About 15% have hypersomnia, or when you get too much sleep. Insomnia, though, is the most common. A resounding 80% of people with depression have insomnia. The lack of quality and consistent sleep can interfere with your serotonin production, which contributes even further to depression. Lacking sleep also affects your body's stress system and interrupts your circadian rhythm. And sleep deprivation increases cortisol production in your body. Most people call it the stress hormone. It's what kicks your body into fight or flight mode. All of this creates the perfect breeding ground for insomnia. Nearly half of all people with insomnia also have clinical depression. And like we said, 80% of people with depression experience bouts of insomnia. Insomnia doesn't only mean trouble falling asleep. It also involves waking up too early. Those with depression tend to bounce between insomnia and hypersomnia when trying to catch up on sleep. This leads to the big question: do people suffering from depression need more sleep? Well, yes and no. If you suffer from depression, you need the right amount of sleep. According to the CDC, adults need at least 7 hours each night. Ideally, you shouldn't go over 9. If you do, you're teetering on oversleeping territory. In fact, about 15% of people with depression oversleep. Oversleeping is actually linked with something called atypical depression. Atypical depression is the idea that one's mood improves in response to a positive event. Think receiving a gift or getting a new job. But those positive mood shifts are only temporary because the real underlying issues causing your depression haven't been solved. So in one sense, sleeping can be a form of escape, but unless someone deals with the root causes of their depression, it can be haunting. There's a clear connection between depression and sleep disorders. Addressing one will most likely help the other. But remember, just because you feel tired doesn't mean you're depressed. Those who suffer from depression often have trouble sleeping, but how can you tell if your sleep troubles are the sign of something more serious, like a mental health concern? Before you get worked up thinking you might be depressed, ask yourself this vital question: am I just tired? It all has to do with your desire to do things. Tired people want to engage in daily activities but lack energy. People who are depressed aren't interested in those activities even if they're well rested. Understanding the common symptoms will also help determine if you're depressed or tired. If you suffer from depression, you're likely to experience some of these symptoms. You may have irregular sleep patterns and feel tired during the day and wide awake at night. You likely lose interest in the things that once brought you joy, like art or music. You could also feel guilty, hopeless, and worthless for not participating in those activities. You may lack energy and feel fatigued most of the time. And you could also have trouble concentrating, which could be a sign of underlying ADHD. In fact, many doctors call depression and ADHD coexisting conditions. You might also either lose your appetite entirely or tend to overeat. And finally, in severe cases, you might experience thoughts of death and suicide. But again, the point here is frequency. If you're feeling tired, fatigued, and uninterested in things that typically make you happy, and this is because you haven't slept for a couple of days, it's likely you're not depressed, just sleep deprived. But if you find that these symptoms persist for several weeks or more, then it's worth talking with someone about it. And it can really help. People who undergo treatment for depression report improved sleep and overall better quality of life. Counseling is a great place to start. Talking through your symptoms and practicing cognitive behavioral therapy, CBT, can improve your sleep. Antidepressants are also effective at combating depression once you find the right drug and dose. However, SSRIs have been shown to reduce REM sleep, which is essential for restorative and well-rested sleep. Lack of REM sleep can present depression-like symptoms, including lack of concentration, daytime sleepiness, and irritability. Depression doesn't have to control your sleep. Let's talk about some steps you can take to improve your sleep overall. First, talk to a therapist. They'll help you cope with depression and offer a variety of mental tricks you can use to process your feelings. Sometimes a behavior change is all you need. Next, make sure you're sticking to a consistent sleep schedule. Try going to bed and waking up at the same time every day. Forming a relaxing wind-down routine tells your body when it's time to sleep. Avoid screens, bright lights, and stressful activities for at least an hour before bed. People who are depressed often feel inclined to nap. While naps are okay, keep them brief and early. These are called power naps. They're 10 to 20-minute naps you can take around lunchtime. Sleep longer than 20 minutes and you'll fall into deep or REM sleep. Waking from these cycles leaves you feeling groggy and tired. It's counterproductive to say the least. Shorter than 10 minutes and you won't get any restorative benefits. Experts suggest napping at least 8 hours before bedtime. So if your bedtime is 10 p.m., don't nap after 2. Some people drink before bed to take the edge off. Do yourself a favor, don't. Even a little alcohol can prevent you from getting a restful night's sleep. Instead, try getting outside and exercising during the day. Natural sunlight does wonders for your mood and circadian rhythm. Daily exercise will increase your sleep quality and reduce your depression symptoms. Just don't work out too late at night. Sleep and depression don't have to be this vicious circle. Grab the bull by the horns and wrestle that sucker into bed. Keep an eye out for symptoms of depression and call your doctor immediately if you're experiencing harmful thoughts. Establishing healthy nighttime and exercise habits are the first steps toward better sleep when dealing with bouts of depression. Trust me, when you sleep better, you feel better. Thanks for watching, everyone. Sleep well.